Chinese aesthetic medicine is so cheap it must be unsafe, right? If you've ever thought this, you're definitely not alone. It's probably the most common assumption people outside China have about medical aesthetics here. But today, I want to share 5 facts you've likely never heard before that might completely change how you look at this. The price difference isn't about cutting corners on quality. It's about a market reality that most people simply don't know. Why cheap doesn't mean unsafe. There's no denying that aesthetic treatments in China cost significantly less, typically 50% to 75% less than in the United States, and roughly 40% less than in Korea, even before the recent tax refund cancellation. But that price gap mainly comes from 3 things. Lower labor costs. Chinese doctors operate under a different compensation structure than their US counterparts. Lower operating costs. Clinic rent in Shanghai is still a fraction of what you'd pay in Manhattan or central London. And localized supply chains, a large portion of equipment and consumables are manufactured domestically, cutting out import duties and long-distance shipping. None of these factors have anything to do with the actual quality of medical care. With that context in mind, let's look at the 5 facts. Surgical volume ranks among the highest globally. China performs over 1 million laser eye surgeries per year. To put that in perspective, a senior ophthalmologist at a leading Beijing hospital might perform more smile procedures in a single month than an American colleague handles in an entire year. In aesthetic medicine, there's a direct correlation between surgical volume and quality outcomes. When a doctor is operating every single day, their ability to assess situations, make judgment calls, and handle unexpected complications sharpens considerably. For you as a patient, this means the doctor across the table may have significantly more hands-on experience than someone charging 3 times as much back home. Leading hospitals operate equipment on par with the West. When it comes to China's leading aesthetic institutions, most people outside the country simply don't know what's available. Shanghai 9th People's Hospital has a plastic surgery department that consistently ranks at the top nationally. Beijing's Badachu Plastic Surgery Hospital is similarly regarded as one of the most established centers in the country. The hardware in these facilities, from 5th-generation thermage machines to ultrasound devices, from 3D facial imaging systems to endoscopic-assisted surgical platforms, is essentially the same equipment you'd find on Rodeo Drive in Beverly Hills or on Harley Street in London. The technology and tools you're exposed to at a leading Chinese hospital are no different from what you'd encounter in your home country. Regulatory oversight is stricter than you might assume. China implements a rigorous licensing system for aesthetic medical institutions. Any clinic offering aesthetic medical services needs to hold a medical institution practice license issued by the local health authority. Doctors need to pass the National Unified Medical Practitioner Qualification Examination and additionally obtain a medical cosmetic physician certificate before they can independently perform surgical procedures. Practicing aesthetic medicine without proper credentials is classified as a legal medical practice and can result in criminal prosecution. In certain respects, this regulatory framework is more stringent than what you'd find in some Western countries. A population of 1.4 billion translates to unmatched clinical exposure. China has 1.4 billion people. That enormous population base means Chinese doctors encounter a breadth and complexity of clinical cases that far exceeds what their peers in many other countries see. A Chinese surgeon specializing in nasal revision might handle in 1 year a caseload that would take a European counterpart a full decade to accumulate. If you're considering a more complex reconstructive procedure or a nuanced facial adjustment, choosing a doctor who has seen it all is often a safer bet than simply choosing the most expensive option available. Post-operative care infrastructure is improving rapidly. One of the biggest concerns about getting aesthetic treatments abroad is what happens after the procedure. The good news is that an increasing number of Chinese aesthetic clinics have built comprehensive service chains specifically for international patients. Remote video consultations before you even book your flight, professional medical translators present throughout your treatment, and structured post-operative recovery programs that include 7 to 30 days of accommodation near the clinic with scheduled follow-up visits. Long-term aftercare is handled via WeChat, WhatsApp, or email, and some institutions even offer complication insurance and referral networks with partner clinics in your home country for continued checkups. Even after you fly back home, you can stay in direct contact with your treating physician. So those are 5 facts that might have shifted your perspective on aesthetic medicine in China, at least a little bit. My belief has always been that any medical decision should be based on thorough understanding, not on stereotypes. If you still have concerns or questions about getting aesthetic treatments in China, drop them in the comments below. I'll do my best to respond to each one. And if you have friends who are exploring their options for aesthetic procedures, feel free to share this video with them. Regardless of where they ultimately decide to go, having more information is always a good thing. In the next episode, I'll tackle another question I get all the time: how to navigate the entire aesthetic medicine process in China if you don't speak a word of Chinese. Make sure you're subscribed with the notification bell on so you don't miss it.